Hi there, my name's Ben Norris. I'm one of the salary GPs at Clare House. I qualified on the Exeter scheme in 2019 and I started my job at Clare House in September of that year. I do 6 sessions a week and I have a list size of about 1,100 patients here. So I've recorded this short video just to talk a bit more about GP admin, what it is and how to deal with it. After actually seeing and speaking to patients, I think managing the admin side of things is the next biggest responsibility that you have in your role, especially if you're a list holding GP, but even without holding a list, you're going to handle some admin on a day-to-day basis. I remember when I first started, it wasn't something that I had a lot of exposure to. I don't think during your training you often get the opportunity to do a lot of admin. So by the time you do start your job, it can seem quite intimidating. You're getting a lot of letters, test results, and so on that you might not understand quite what they mean or exactly how best to deal with them. And this can be a bit disconcerting when you first start your job. So I hope that, speaking from my experience, I might be able to give you a bit of advice about how to approach it at the beginning, and also some tips on how to keep on top of it once you do start your job. So what is the admin? So basically there are different kinds of things that you're responsible to do. So it would include blood results, letters from the hospital, from clinics, follow-ups and so on, and signing repeat prescriptions. You might also have direct communication from patients who might want to write to you about certain things that are affecting them, and so responding to those as well. And there's also kind of internal correspondence from the practice. Perhaps another doctor is asking you advice, perhaps a nurse has contacted you about a patient, and trying to keep on top of that correspondence as well. So, in terms of what you can do before you start your job, I think it's really about trying to get as much exposure to the admin side of things as you can during, especially your ST3 placement, but even earlier if you can. So one thing I would suggest you do is perhaps sit in with your supervisor, watch how they do their admin, see if you can pick up some advice and tips from them, and just get used to the idea of how much time this needs to take during your job. As well as sitting in with your supervisor, you might want to sit in with different GPs from your practice. They might all have slightly different ways of processing the same kind of things, and you might pick up on different ways of doing things that work better for you and might seem more efficient. I'd also suggest, if you can, as a trainee, is trying to ask to be sent some admin to process yourself, especially if you were to see a patient and decide that they needed, say, some blood tests. You could specifically ask that those blood tests come back to you, so you can then interpret them in the right context, work out what to do next, and then see that plan in action. And that's a good way of just easing yourself into it. Once you start your job, or actually I think even before you start your job, it's important to try and gauge during negotiations how much time you're going to be allocated to do your admin. And a lot of practices will have some sort of proportional timetabling system, depending on the number of sessions you do, dictates how much time within those sessions are given away to admin. And so it's important, I would say, to make sure you do have some time scheduled specifically to do your admin. If you're feeling a bit uncertain about it, you might ask for perhaps a graded exposure to your list. So rather than diving in with 1,000 patient list and expecting to keep on top of all that admin, perhaps you could ask to start with 500-600 patients, just to give yourself a chance to get used to the workload that involves. You might also be having to get used to a new computer system at the same time, which can also be quite tricky. So it might be sensible to just ease yourself into it that way. You could also ask for some supervised time with one of the partners, perhaps, just to make sure that you're familiar with not only the IT system, but the nuts and bolts of actually how to process the admin properly, whether that's how do you organize a repeat blood test, how do you communicate the results to the patient, who's responsible for following up certain things. That could be a helpful step to get your head around things. I would say from experience, it is a bit intimidating at first. I think you might be coming across results that you don't really know what they mean or what you need to do about them. So I think it is important to try and ease yourself in as best you can. It does get easier as time gets on. You get to know your patients a bit better. You get to understand what those results and follow-ups mean for them in context. And it can be quite satisfying at the end of the day once you've got used to things, got used to the system, and are starting to put plans into action yourself. You can get quite a lot of satisfaction about seeing all those plans through and seeing those episodes of care through for your patients. And you will get more efficient in time. My top tips would include, as well as what I've already mentioned, is during a working day, although you may have time specifically allocated for admin, is any 5-10 minutes spare you get during the day, which I appreciate might not be very much, but trying to chip away at a few things, even if it's just to file away a couple of prescriptions, a couple of normal blood test results, the more you can chip away during the day, the less you'll have to do at the end of the day. If you do choose to do it that way, you may find you get through your whole list of patients. It comes to 6 o'clock in the evening, and you've got a lot of blood results to file that might need urgent action, and you're then sat there until 7:30 at night trying to do it all. So the more you can get done during the course of the normal day, the better, if you can. Further to that, I would suggest if you see a result and you've got time, try and action it there and then. So try and write the referral letter there and then. If you see a blood result, try and put it away there and then. If you see a letter you need to respond to, try and respond there and then, ideally by dictating if you can. It does save you time, especially if you do, rather than typing out 5-6 letters, dictating them, you can do that in a few minutes, and it all buys you time. I would also suggest trying to make the best use of whatever IT systems the practice uses. Here we use quite a lot of text, so rather than, for example, the patient having to ring up to get their normal blood test results, I often will just send them a quick text to let them know their blood results are fine. If they're amenable to that, I think that's a good way of communicating. It saves the patient being on the phone. It saves potentially an appointment when you have to explain something you could explain over text. So I would really recommend that way of doing things if you can. Email as well. Again, quite a quick and easy way to communicate simple things that can save you time. And just trying to be, as efficient as you can, trying to be on the ball, try and do things there and then as much as possible. So I hope that's helpful. Just bear in mind, at the moment, probably the priority for you is trying to get as much exposure to the actual process as possible. Just makes it a bit easier when you do start, that it's not too much of a hard landing. But just be reassured that it does get easier in time, especially when you get to know your patients, you get to know the IT systems, and you get more confident in doing what you do.